Hi everyone, hello to the episode 6 of Weekly Delights. Am I audible to you? Just let me know in the chat box quickly. Am I audible and my screen, my board is visible to everyone? Yeah? Okay, great. Okay, hi. So here's the episode 6 of Weekly Delights, a quick session of the requested topic, that is types of mastectomy. So quickly I want you to go through the surgeries which we perform for breast cancer. So all the important surgeries which come under breast cancer will be discussed here very quickly. So we'll go from very basics and take help of a very nice MCQ which is in front of you. Okay. So now what this MCQ says. This MCQ has a very big question, a clinical scenario. So what you need to do is you need to pick up important points from this given MCQ. Okay, so what you are basically having is there is a 43-year-old lady who has stage 3B breast cancer, right, in the left breast. Okay, then she says that the surgeon plans a surgery for her, and her relatives as well as the patient wants to know what is to be done in the surgery. So now here comes the actual liners which you need to pick up from the question, right? So what the surgeon describes, that her left breast along with the nipple areola complex, skin, and level 1 and 2 of the axillary lymph nodes are to be removed, right? So if you look at this very carefully, what you will get, what we are removing the breast along with the nipple areola complex, along with the skin over the breast and nipple areola complex, along with level 1 and 2. This is the first thing you need to pick up from this question. The second thing which has been given here very clearly is that the adduction, medial rotation, and protraction of scapula will be preserved. This is what is the assurance given by the surgeon to the patient, that adduction and medial rotation at the shoulder joint, protraction of scapula will be preserved. Now, in relation to breast anatomy, what are they talking here about? So this line actually points towards that pectoralis major and minor will be preserved, right? So this basically means that pectoralis major and pectoralis minor are going to be preserved. So that is what we need to know. So now we have all the things we need to be picked up from this given specific scenario. Now what one step ahead they have given, that during the surgery the surgeon retracts pectoralis major muscle. Okay, what we have here, that during this surgery the surgeon has retracted pectoralis minor to explore the level 2 of axillary lymph nodes, right? What they are asking, that which breast surgery is performed in this given clinical scenario. So not asking you directly about the components of surgery, but in the form of a clinical scenario. That's what is the skill of framing a question examiners have. For that, before coming to the options, let's quickly discuss the part that we need to discuss today, right? So first, before going to anything, a very basic thing I want you to understand, what are the levels of lymph nodes that you need to know, because in the question also we are talking about, when I'll be discussing the types of surgeries, at that time also I'll be talking about level 1, level 2, level 3, what these levels actually are. So what these levels actually are, imagine this to be the coracoid process, and imagine this to be the pectoralis minor muscle which is inserted over it. Okay, imagine this is the pectoralis minor muscle. So what is this? This is pectoralis minor. Okay, this is pectoralis minor. So now in relation to the insertion of pectoralis minor muscle, Either it would be lateral and below, or it would be medial or and above, or it would be behind. Right? These could be the three relations to the insertion of pectoralis minor muscle and its fibers. So if you look at this very carefully, the group of lymph nodes which are present lateral and below the insertion of pectoralis minor, this will be known as the level 1 of the lymph nodes. Now, which group of axillary lymph nodes come over here? So the axillary lymph nodes which come under 1 are anterior axillary, posterior axillary, and the lateral group of lymph nodes. Anterior, posterior, and lateral group of lymph nodes come under the group 1 or the level 1 of the lymph nodes. Then there are certain level of lymph nodes, certain level of axillary lymph nodes which will be present behind pectoralis minor muscle or hidden with just below the pectoralis minor muscle. These group of lymph nodes will be termed as level 2, and the lymph nodes which we have in level 2 are central group of lymph nodes and interpectoral group of lymph nodes. Okay, so you have center and interpectoral group. Why interpectoral? Interpectoral का मतलब है between pectoralis major and pectoralis minor muscle. So if you are having a group of lymph nodes between pectoralis major and minor, we call them as interpectoral, or these are also called as Rotter's group of lymph nodes. Right, Rotter's group of lymph nodes. Whereas level 3 will be above and medial to the insertion of pectoralis minor muscle, and these will include the apical group of lymph nodes. The apical group of lymph nodes. So this is what basic we need to understand. So in the surgeries, if I say that a surgery, like if I talk when I'm discussing MRM, modified radical mastectomy, in that case I'll say that in this surgery we remove level 1 and level 2. What does this mean? We are removing anterior, posterior, lateral, central, and interpectoral or Rotter's group. That is what I actually mean, right? So now let's go to the types of surgery we need to know. So the first type and a very basic type of surgery that we need to know is Halsted's radical mastectomy. Now what is Halsted's radical mastectomy? Radical का मतलब होता है to remove everything. So whenever in surgery you have a word radical, this means everything related to the area or the region of interest is to be removed. So what do you actually include in Halsted's radical mastectomy? What things are removed? Okay, what things are removed? The structures that are removed are breast, nipple areola complex, skin, level 1 or 2 or 3 means additional to level 1, plus you remove pectoralis major muscle, plus you remove pectoralis minor muscle. So all the related things or anatomical structures in that area will be removed. That is breast, nipple areola complex, skin, level 1, 2 and 3, along with pectoralis major and minor will be removed, right? Then you have the next type, which is called extended radical. Now what do you mean by extended radical mastectomy? Extended radical mastectomy is nothing but your Halsted's radical. That means this green one that I have written above: breast, nipple areola complex, skin, level 1 to 3, pectoralis major and minor, plus internal mammary group of lymph nodes. Okay, so if you are removing the elements of radical mastectomy of Halsted's, plus you are removing internal mammary group of lymph nodes, then we call it as extended radical mastectomy. Next you have is something called super radical mastectomy. Now what do you mean by super radical mastectomy? Super radical mastectomy means nothing but, it is nothing but your extended radical plus supraclavicular with or without mediastinal. So if you are removing all the components of Halstead's radical along with internal mammary, and along with that you are also removing supraclavicular and few of the mediastinal group of lymph nodes, then it is called a super radical mastectomy. Then it is called a super radical mastectomy, right? Then two very basic types which are not much practiced nowadays. For few conditions we do that, but not very commonly, is simple mastectomy and extended simple. Now what is simple mastectomy? A simple mastectomy is nothing but you are going to just remove the breast, skin and nipple areola complex. No touching to the lymph nodes, no touching to the blood vessels, no touching to the nerves. Just remove breast, skin and nipple areola complex. This is simple mastectomy. What is extended simple? Extended simple is nothing but simple mastectomy along with removal of level 1. Just remove level 1 along with breast, skin and NAC. That will be called as an extended simple mastectomy. Coming to the most area of interest and the most practiced type of mastectomy, that is modified radical mastectomy. Now what is modified radical mastectomy? Modified radical mastectomy is a modification of radical mastectomy for sure. But what are the structures that we remove? So the structures that are removed are breast, nipple areola complex, skin over the breast and nipple areola complex, along with level 1, 2, 3 plus you are going to preserve certain things. So basically just removed are these things, that is breast, nipple areola complex, skin, level 1, 2 and 3. So here what we are going to do? Here we are going to preserve pectoralis, major and minor. But the question which is asked further step is what are the other important structures that are to be preserved during this procedure. So the structures which are to be preserved in this procedure are long thoracic nerve of Bell, which is going to supply the serratus anterior. So they can give you a clinical scenario where a not well experienced surgeon has done the modified radical mastectomy, and after that patient comes with winging of scapula. What was the nerve which was not preserved during the surgery? The answer would have been long thoracic nerve of Bell. Then the second structure that has to be preserved is axillary vein, and the third structure are the thoracodorsal pedicle. The thoracodorsal pedicle, that is the structures involved are thoracodorsal nerve, thoracodorsal vessels. So basically you need to preserve long thoracic nerve of Bell which supplies serratus anterior, axillary vein and thoracodorsal vessels and nerve which supply the latissimus dorsi muscle, right? So these are the structures that have to be preserved. One step ahead more are two important points. What is the name of incision we give when we do modified radical mastectomy. Remember, modified radical mastectomy, this is the most common breast surgery which we perform. So what is basically done under modified radical mastectomy is that what incision are you giving? So imagine this to be the breast along with the nipple areola complex, and imagine this to be a tumor. What are we going to do? We are going to give an incision which is called as modified Stewart's incision. Okay, modified Stewart's incision. Now what is this modified Stewart's incision? It is an elliptical incision which is given over the skin over the breast, where the medial boundary, suppose the point A, and a lateral boundary, suppose the point B. Now what is this medial boundary? That is point A. It is the left sternal border in the fifth intercostal space. So in the fifth intercostal space, left sternal border, you are going to give the medial most incision, curve it as a superior extension and a inferior extension, or superior lip of the incision, inferior lip of the incision, and point B where both are meeting, that will be in the anterior axillary fold. Okay, this is the incision which we give. Very important question, modified Stewart's incision. Last but not the least about this specific surgery is the types of MRM. So if I take modified radical mastectomy, there are types of MRM. This is what is basically being checked in the MCQ that I have shown in the starting of this video itself. So now, based on what are these types basically taken? These types are taken in relation to the action over pectoralis minor to explore level 2 of lymph nodes. That is what I wanted you to know. That's why I have taken some time to discuss levels. So if you want to go to level 2, I told you level 2 is a central group of lymph nodes as well as the interpectoral. So देखो, pectoralis major तो we can retract easily because it's a large muscle, we can easily retract it laterally or medially. But, and then you will see the interpectoral group, but pectoralis minor muscle, the level 2 is very quite hidden behind this pectoralis minor muscle, that is the central group. So to reach and explore to those level 2 level lymph nodes and remove them during the modified radical mastectomy, we need to do something with that pectoralis minor muscle, and depending upon what we do to that pectoralis minor muscle are the types of modified radical mastectomy. So let's discuss that now. The first type of modified radical mastectomy, that is called Pate's MRM. That is called Pate's MRM, Pate's modified radical mastectomy, where we are going to cut pectoralis minor muscle. Okay, इसका मतलब क्या है? Imagine this to be the pectoralis minor muscle. What I am going to do is I am going to divide this pectoralis, cut this pectoralis minor muscle. You will get two flaps, the medio-inferior flap and the superolateral flap. You will retract those flaps after cutting the muscle perpendicular to the fibers. Then you will see the level 2, that is central group. Remove them and suture back the muscles. So you definitely can understand, since I am cutting through the muscles, the prognosis is going to be relatively poor, right? That's why Pate's MRM is not practiced now, and this was the first MRM which was shown. Second is called the Scanlon's MRM. That is called the Scanlon's MRM, and in Scanlon's MRM we divide pectoralis minor. Now what is the difference between cutting and dividing? Let me show you in the image. Imagine this to be the pectoralis minor muscle fibers. What I am going to do here is, along the longitudinal axis of the fibers, I am going to split the fibers of the pectoralis minor. Means in pates I was cutting perpendicular and dividing it into two parts, whereas in scannulons, just like in open appendicectomy, where we divide the external oblique, internal oblique fibers through the gridiron incision. Similarly over here, along the longitudinal axis of pectoralis minor, we will split the fibers and then approach the level 2. That is called as cannulon's modified radical mastectomy. Okay, and the third type, which is very commonly practiced, actually the most common practiced breast cancer surgery, is Auchincloss modified radical mastectomy. Now what is this Auchincloss modified radical mastectomy? We are simply retracting the pectoralis minor muscle. What do you mean by retracting? Very simple. Imagine this to be the pectoralis minor muscle. I am going to simply take a retractor, usually like Bowen's retractor or whichever retractors you have. There are not much special retractors for this, but simply you are going to retract the muscle medio superiorly. Once you retract it, and your assistant is going to help you to just retract that muscle superolat-medially, you will be able to see the level 2 lymph nodes below, scrape and cut them through and dissect them out. And again, once you remove that retractor, the muscle will come in position. So definitely you know the injury to the muscle fibers is least in case of Auchincloss modified radical mastectomy, and that's why this is the most practiced, and this is the best breast surgery which is done nowadays. Okay, this is the best surgery which is done nowadays. That's about Auchincloss. Last surgery which I quickly want to review for all of you, that is BCS, that is breast conservation surgery. Now what is this breast conservation surgery? This is a surgery which is used actually for early breast cancer. Here what we actually are doing is, we are doing three things. Very quick review. What we are doing in breast conservation surgery, we are doing a lumpectomy. That means whichever part is involved, I'll draw a diagram and show you. We are going to do lumpectomy, then you are going to do axillary lymph node sampling, and finally you are going to give radiotherapy to the patient. So remember, radiotherapy ka one compulsory indication is breast conservative surgery. What we are doing here, imagine again this to be the breast. Okay, this was a tumor, a early breast cancer. So what we are going to do here, with a margin of about 1.5 centimeters, I am going to remove that lump. Okay, but before doing that actual lumpectomy, what I'll do, I'll take a syringe and I will inject a dye, and that dye is nothing but isosulfan blue. That is isosulfan blue. Now imagine this is a lymph node, this is a lymph node, this is a lymph node, but out of these lymph nodes, I saw that there is one lymph node who has taken up this dye. So there is a lymph node which has taken up this dye. This first lymph node in the axilla which has taken up this dye will be called as a sentinel lymph node, right? That will be called as a sentinel lymph node. And so if I get such sentinel lymph node, I'll send this to the pathology. I'll send this to the pathology lab, and if this turns out to be positive of having some malignant cells, then I'll go back and dissect level 1 and 2. Mostly level 1 and 2. In rare cases we need 3 also, but mostly level 1 and 2. right? So what we are doing, we are first pushing a dye. We will look at which lymph node takes up the dye first. That will be called sentinel lymph node. Take that lymph node sample, send to the pathology lab. If it turns to be positive, go back and do level 1 and 2. And simultaneously, till the report comes from the pathology lab, you are going to do lumpectomy. That means you are going to simply remove this lump with a margin of 1.5 centimeters. And after this entire procedure, you have to give whole breast radiotherapy. You are going to give whole breast radiotherapy. This is what we are actually doing in BCS. So that's all about all the different types of breast surgery. Now coming to our MCQ, which was asked to us. See, we are removing breast, we are removing nipple areola complex, we are removing skin, we are removing level 1 and 2 in this question. But it simply says that the surgeon assures that he will preserve adduction, he will preserve medial rotation and protraction of scapula. That means he is going to preserve pectoralis major and minor. What this surgery is? This surgery which I am talking about is nothing but modified radical mastectomy. I am talking about MRM. But if you see in this entire options, I have all the three types: pates, auchincloss and scanlons. Now the task is about the last line. Whenever a big question is there, just read the last line. If I can see the last line says that surgeon carries out this surgery during which he retracts pectoralis minor. What we do in pates? In pates, we cut pectoralis minor. In auchincloss, we retract, right? And in scanlons, what we do in scanlons, we divide, right? So at the end, out of these three options, what do you think is the best answer? The best answer to this question is definitely option E, that is auchincloss modified radical mastectomy. That's all for today. I hope that we have discussed all the things to the point, most high yielding things as much as possible. Thank you and goodbye.